Welcome. This is Kubatana, Together as One. Today we have Dr. Nomsa Tsikai. She's a top oncologist in Harare. She's got a private practice of her own. And today she has kindly offered to tell us about cervical screening as well as cervical cancer, because this is Cervical Screening Awareness Week from June 15 to June 21. As part of our practice at Kubatana, we want to educate us as much as possible so that we can look after ourselves as well as look after other people. And Dr. Nomsa Tsikai, welcome to the group.
Welcome, Doctor.
Thank you.
Okay, so Doctor, I'm going to give my mouse over to Dr. Nomsa Tsikai so she can share the screen with us. So it's over to you, ma'am.
Thank you, Rita. Okay.
Okay, I think you've got access now.
Working now?
Yes.
Okay, great. Yeah, so I hope you're seeing it clearly.
Yeah,
Yes, we can.
Okay, excellent. Okay, yeah, so I'm going to just talk about cervical cancer. So the one thing I'm failing to do, okay. Yeah, so I'm just going to talk briefly about what cervical cancer is, how common it is, and the causes, signs and symptoms, screening and early detection, how we diagnose it, and how we treat it. So basically, cervical cancer affects the female reproductive tract, and it's the most common cause of cancer deaths in areas where Pap tests are not readily available. So Pap tests, that's screening, which we will get into. And it is the easiest gynecologic cancer to prevent through screening and early vaccination. So basically a little bit of anatomy. What is the cervix? So this diagram is just trying to show, it's showing the female gynecologic system. So we have the uterus, the fallopian tubes, the ovaries, and the opening to the uterus. So this small area here, that is the cervix. So we do find that, the cervix, because it is easily accessible, as you can see from the diagram. So we have the vagina, which opens up into the cervix, and then the uterus. It is an area that we can easily access for screening. I will discuss a little bit further. So how common is this cancer? We find about 500,000 of women worldwide are diagnosed with cervical cancer annually. And it is unfortunate that majority of these cases are in developing countries like Zimbabwe. So in Zimbabwe, it is the #1 cancer, causing about 1/3 of cancers in women, and #1 cause of cancer deaths. And just looking at the whole world in general, looking at the most common cancers by country, you'd find, so they are color-coded. So the pink areas, that's the most common cancer, that's breast cancer. So occurring generally worldwide. And then #2, that's cervix cancer, where the darker orange areas are. So you're finding it in South America, in Africa, and in parts of Asia. So these, unfortunately, are the developing countries. And then just zeroing in on Zimbabwe, like we mentioned, that cervical cancer is the #1 cancer. So about 18% of cancers, that's the incidence of all cancers, and also mortality as well. It does come as the #1 cancer. And then just going into the causes of cervical cancer, it is one of the cancers where we have actually identified the cause in about 90 to 95% of the cases. It's caused by human papilloma virus, okay? So human papillomavirus is a sexually transmitted virus. So almost all sexually active women have had human papillomavirus at some point. And the body usually is able to clear it. The body's immune system has an ability to clear this virus. So you find that the risk factors for cervical cancer are related to sexual contact. So then if one has had sexual contact, the likelihood of getting HPV virus. So there's certain factors that increase the risk of getting the HPV virus and also having it become more virulent to the point of causing cervical cancer. So things like having sex at a young age, we do find that increases one's risk. And a lot of the times it's because when one has sex at a young age, their cervix is immature. Therefore, if it's infected by HPV virus, it is more likely to be damaged and resulting in cancer development. And then having sex with someone infected with human papillomavirus increases the risk. They have found long-term use of contraceptive pills can also increase risk. Family history of cervical cancer has been implicated. Depressed immune system also is a risk factor. And with this one, mainly because for most patients, HPV virus is cleared by the immune system. But when the immune system is down for whatever reason, and in our environment in Zimbabwe, for most patients, it's because of HIV infection. So if one has HIV infection that is not well treated, that's not well managed, that low immune system increases the risk of failing to clear HPV virus and developing cervical cancer. Having multiple sexual partners also increases one's risk of getting infected, and smoking has been found to be a risk factor. So, you know, people would be interested to know, how can one know whether they've got cervical cancer? So I always like to just stress the point that by the time one has symptoms, a lot of the times the disease is advanced. So for cervical cancer, number one is screening before one has had any development of these symptoms, but it's still important for us to be aware of these symptoms. So basically, one can have continuous vaginal discharge. So that's generally an abnormal discharge, which in most women, they would have described that they had gone to the clinic, had treatment, but no improvement. So this discharge can be foul smelling, it can be a thick discharge, it can have discolored discharge from what is normal for a particular woman. One can also have abnormal vaginal bleeding. So we usually talk about postcoital bleeding. This is bleeding after sexual contact. Irregular vaginal bleeding, that can be intermenstrual bleeding, especially in premenopausal women. And then also commonly for postmenopausal women, they can have bleeding. So you hear somebody saying, you know, when I'm asking the history, especially for the elderly women, that they describe it as, you know, Gogo, the grandmother, had stopped having menses some years back, and all of a sudden the menses have come back. So a lot of the times, because the bleeding is not painful, they just think, oh, okay, she's now having a menses again. But people have to know that once somebody has stopped having menses because of menopause, any bleeding that comes after that is abnormal. And pain in the lower abdomen or back, that also can be a sign of cervical cancer. And in most instances, that's advanced cancer. And things like leg pain or swelling usually also points towards advanced cancer, and unexplained weight loss. And yes, the most important, screening and early detection. Like I mentioned, we don't want to develop signs and symptoms. We want to catch women before they've developed any abnormalities. So that is screening. So do not wait to have any problems, do not wait to have pain, to have abnormal vaginal discharge or bleeding. So screening, how do we screen for cervical cancer? So we have three main ways: pap smear or pap test, VIAC test, which is visual inspection with acetic acid, and the human papillomavirus test, which is a more recent way of screening. So I will touch on these briefly. So a pap test, this is a test which collects cells from the surface of the cervix and looks for any abnormal cells. And these abnormal cells can be treated before cervical cancer develops. That's the advantage of catching cancer before it has started having any symptoms. So when cancer is detected early, it is easier to treat. And then our VIAC test, basically this is visual inspection with acetic acid and camera. So a picture of the cervix is taken and compared with normal picture and abnormal pictures. And that way we're able to determine if there's an abnormality. The advantage with the VIAC test, if one has early changes, they can be burnt off, frozen with cryotherapy, that's liquid nitrogen, or burnt off with loop electrical excision procedure at a single visit. So if one has a VIAC test and they find early abnormal changes, treatment can be done immediately. Mm-hmm. So this picture is just trying to show the different changes that can occur, okay? So these are early changes that can occur when you put in that vinegar. You see the white changes that you see. So this is early changes that can be burnt off with the LEAP procedure that I mentioned earlier, or frozen with the liquid nitrogen, okay? But on the other end here, we have more advanced cancer that shows as abnormal lumps or growths on the cervix. These ones, just burning them off or freezing them is not enough. These, for a lot of women, we have to actually treat using different types of treatments that I'll mention. So, so if one has cervical cancer, how do we diagnose it? So if we find an abnormal pap test or VIAC test, we can do a special test called a pulcoscopy and biopsy that helps to, for us to get a sample of the abnormal area that's taken to the lab, looked under the microscope and looking for abnormal cells. So that's how we diagnose cancer, by seeing abnormal cells under the microscope. So this is a colposcopy. So basically here they use a magnifying instrument, apply also vinegar-like solution that shows abnormalities that cannot be seen by the naked eye. And if one has this, then we're able to take samples and determine if one has cancer or not. And then cervical biopsy for the larger nodules or lesions that we see. So let's say we're seeing this red dot here. They're using a special biopsy forceps like this one. They take a sample from the abnormal looking area, and that's taken to the laboratory. And then the other test is the HPV test. So basically with the HPV test, we're saying that HPV virus that's sexually transmitted. They take samples from the cervix, take those to the lab to see if one has the HPV virus, okay? The most common viruses that HPV virus that causes cervical cancer is HPV 16 and 18, but there are other viruses, other strains of HPV that cause this, okay? So the advantage of the HPV virus is that they've developed a vaccine that helps to prevent those high-risk HPV types that cause about 70% of cervical cancers. And we advocate for this in young girls between the ages of 11 to 14 years of age before they become sexually active, to reduce the risk of HPV exposure when they do become sexually active. Okay, so so yes, these are the recommendations. Young girls, and in certain countries, they're also giving it to young men as well. Okay. And then when we're talking about treatment of cervical cancer, treatment of cancer generally stage dependent. We have 4 stages of cancer, from stage 1, 2, 3, up to stage 4. So this diagram here is just trying to illustrate, when we're talking about stage 1, we're saying this is early cervical cancer that is limited to the cervix, okay? When we're talking about stage 2, the cancer has gone beyond the cervix a lot of the times to attach onto areas around the tissue areas around the cervix. And then stage 3, the cancer goes lower down to affect the vagina. It can also track further down along the tissues to attach onto the pelvic bone, as shown here. And then stage 4, early stage 4, the cancer can move anteriorly to attach onto the bladder, or it can grow posteriorly to attach onto the rectum. And then 4B, that's more advanced cancer that goes to affect distant organs. So it travels through the blood to touch the bladder, the liver, the lungs, the bones. So once we've determined the stage of cancer, we're able to offer the women different types of treatment. So these are stage dependent. So for early stage cancer, we can, for most patients, get away with just removing the cervix, the part of the cervix that's affected, just a cone, what we call conization, especially for women that still want to have children. But for most women, we do removal of the whole uterus, that's the hysterectomy. Okay. And then for more advanced cancer, we treat with radiation and chemotherapy. So for cancers that have gone beyond the cervix to affect the tissues around it or pelvis, the radiation comes in. So just to describe radiation a little bit, a lot of people do not understand what radiation is. So basically with radiation, we're using high energy X-rays to treat cancer. So the cancer is directed to the pelvic area where the tumor is. And this now diagram is trying to show our survival rates. So when we have stage 1 cancer, where the cancer is limited to the cervix, we can see our survival rates is over 80%. Most of our patients we're able to cure. So this is the advantage of early detection. When we have more advanced cancer, stage 2, the survival rate goes down 65 to 87%. Stage 3, our survival rates are not too good, 35 to 50%. And stage 4, we lose a lot of patients. We only manage to save 15 to 20% of patients survive 5 years. And then just to summarize, it's important for people to know how to lower their risk. I mentioned the risk factors earlier on, but just as a summary, it's important to make the young girls aware of the fact that they have to delay the onset of sexual activity until they're more mature, because having it when they're younger, especially during the puberty stage, the cervical region is at risk. So they have to really delay it until the time when they're over 20, 21, or remain abstinent so that, you know, one doesn't even get infected by the HPV virus. One needs to know their sexual partner. It's important to have a faithful sexual partner, because if you have a sexual partner that has multiple sexual partners, then your risk is higher. To avoid smoking, maintaining a healthy diet and lifestyle. A healthy diet has been found through research. It has been found that it reduces one's risk of cervical cancer and a lot of other cancers. So that's diet that's rich in vegetables, fruits and vegetables, and low in saturated fats, low in red meat, so healthy meats, white meat. Also diet that's got lots of water. We're looking at 2 to 3 liters of water a day. That helps to clean out the body toxins that can cause cancer. Having a healthy lifestyle, exercising 3 to 4 times a week, at least 30 minutes a day, has been found to reduce one's risk of developing cancer. Practicing safe sex. Condoms have been found to decrease the chances of human papillomavirus exposure. That helps. And if eligible, especially our young girls, to consider getting the vaccine that prevents most cervical cancers. It's important. Also, the most important, to have one's pap test, the VIAC test, HPV testing, as recommended by the healthcare provider. Thank you.
Thank you. Thank you, Remember. Can I ask a question?
Yes.
Yes.
You know, when you spoke about the risk factors, I find that a lot of those risk factors are actually more prevalent, like in the first world. But how do they not translate into more cancer, cervical cancer cases in the first world than in the second world?
That's a good question, actually. Yeah. So the issue with cervical cancer, the pap test, the pap smear test, actually changed the whole the whole area when we're talking about cervical cancer. So in countries where pap smears are done routinely, the incidence of cervical cancer has drastically gone down. They hardly ever see cancers as cervical cancer as we see in Zimbabwe. We're seeing stage 3, stage 4 patients that you saw, that survival is quite dismal. So it's mainly the screening issue. That's the main issue.
How is the screening in Zimbabwe at the moment? I know with the COVID, but just before, is there any screening program in place at the moment?
Yes, we do have screening in Zimbabwe, pap smears, VIAC tests. What's more common, especially for the general population, is the VIAC test because it's much cheaper. Okay,
Sorry,
so it's more widespread. And the pap test is more expensive because you need the cytologist, the lab test, but the VIAC test is much easier. The only unfortunate thing is access to most women is not
Dr.
readily available.
Dr. Tsikai, can we come back in a minute? Can I ask you to just hold the thought and then we'll come back for part 2?
Okay, that's fine.
Okay, thank you.
Thanks.
All of you, I will send an invite just